Hi, Dr. Todd Sullivan from Nova Chiropractic and Acupuncture. In today's video, I'm going to be reviewing the Pso-Rite. The Pso-Rite is a self-massage device that applies pressure along the psoas muscle to relieve the muscle tension and the tightness. So the psoas muscle is a muscle that attaches on your lower back. It dives through your pelvis and then attaches on the femur. When this muscle becomes tight, it can cause chronic lower back pain or hip pain and thigh pain as well. So it's a very important muscle if you're dealing with lower back pain. And often it's undertreated and very neglected and becomes chronically tight because we sit for long periods of time all day long. We often do not stretch this muscle correctly, and it can often lead to a problem. When the psoas muscle becomes tight, it really adds a lot of compression to the spine and will irritate the spine, especially if you're dealing with any kind of disc issue, any chronic disc degeneration, arthritis. This will lead to more pain in your lower back. So with the majority of patients I treat on a regular basis, we're treating the psoas muscle and we're addressing that to help loosen it up. One of the problems is there are some stretches for the psoas muscle, but it's a very difficult muscle to stretch correctly, and it's also a very deep muscle there. So you can't really use a massage gun or any kind of foam roller on it. I know some people have used some kind of harder ball, a little bit bigger than like say a tennis ball, but often that's not deep enough to get to that level. The Pso-Rite product came out and it interests me quite a bit because in the design of it, it looks like it can get very deep and right to the area where the problem is. So what we're going to do is we're going to talk about the product, we'll demonstrate it, I'll show you how to use it, and I'll give you my impressions of it and what my final thoughts are. So this is what the Pso-Rite looks like. It's a rigid piece of plastic and it's obviously in this U-shaped here. And it's actually pretty large. When I first got it, I was surprised by how tall it was and then also how rigid it is. And I was thinking, I don't know, this is gonna be pretty uncomfortable for some patients. But I think if you slowly ease yourself into using this, it's a product that you can get used to. And what's great about it is because it is so rigid and you can see it's so deep, it can get to the level of the psoas muscle where a lot of these other products can't get to the problem area there. So what we're going to do is I'm going to demonstrate how you use it, and we'll talk about some of the implications of using it, and then also some caution when you are using it and to see if you're the right candidate for this. So to use the Pso-Rite, what we're going to do is we're going to place it on the ground, and then we're going to find your belly button, and starting from your knees, we want to basically lower our upper body onto the Pso-Rite, with the belly button being at the main portion of the Pso-Rite, right in the middle of the Pso-Rite. So let's have you slowly lower your upper body onto it. Again, this is going to be pretty aggressive if you're just using it for the first time. So slowly ease your way onto the Pso-Rite. And what Renee's doing now, she's kind of propping her upper body onto her hands and forearms. And this is going to help relieve some of that pressure of the Pso-Rite versus just going all the way down to your chest. That's going to be the maximum amount of pressure that you can get into this using the Pso-Rite. So once you get comfortable, and this may take several times in this position, but what we're going to do, just nice, slowly deep breaths into it like that. And if she wanted to increase the stress in this position, she could gently shift her hips back and forth. And what that's going to do, it's going to get deeper into the abdominal region, getting to the psoas. Now, if she really wanted to increase the pressure, she's lowering her chest onto the floor, and all that pressure is going to be placed right in that middle region there, deep on the psoas there. And again, from that position, she can shift back and forth depending on how much stress is there. And that's the main way you're going to use the psoas. The biggest key is you've got to do this slowly. So let your body get used to it and don't rush into it. It may take a week, 2 weeks, even to get to this position there, and that's okay. But the more consistent you are using this device, the better your lower back and the psoas will feel. The second way to use the Pso-Rite is we're going to apply it just in one region. So what we did is we slide the Pso-Rite to the right, and that's going to allow just the one side to get deep into the right psoas muscle there. So again, slowly lower your upper body onto the Pso-Rite. And again, we want to be kind of right at that belly button level there, but just to the right of that. And what that's going to do, it's going to get deep into that psoas region. This is going to feel a lot deeper because it's just one level of contact. So that forces that area of the Pso-Rite deeper into the area. And you can see she's shifting her pelvis back and forth to try to find that spot where the problem is. And she's just going to hang out there, nice, slow, deep breaths, shifting back and forth if it's comfortable. And then again, if she really wanted to increase the stress more, she's going to lower her chest onto the ground here. And again, it may take you a while to get to that position, but this is the way you would kind of get deeper into the psoas to relieve some more of that pressure. The third way to use the Pso-Rite is to apply it to your glute region. We can apply this to the glutes, the lower back, upper back. I think the best use of it is going to be in the glute region. Now the problem with it is it's going to get very deep. So again, you're going to have to work your way into using this on the glutes, but because there's a narrow contact, it will force it deeper into the glutes. So think of a lacrosse ball using it on that area, but it gets deeper. So Renee, let's have you lay on your back this time, and we're going to place the Pso-Rite kind of in the glute region. Imagine you have your tailbone is in the middle part of the U, and you kind of work back and forth there, and that gets deep into the glutes. And then if she wanted to kind of shift her weight to one side, she could apply that Pso-Rite more into a specific spot if she felt a area that was really tight. And again, you want to hold that position for up to 30 seconds. Same thing when we're working the psoas. Start off holding a position for 30 seconds, and then honestly you can work up to holding it for 2 to 3 minutes at a time. But this is a good way to use the Pso-Rite to kind of get into the area. I don't necessarily like it for the lower back and middle back. I think it's way too aggressive and will actually irritate the joints. So my suggestion is just use it for your lower body if you want to use it for any other areas, and then obviously the psoas is the main function of this device. So overall, I think the Pso-Rite is a great product in terms of getting to the problem area. Again, a lot of the other products on the market can't get to that depth of the issue, but you do have to take that with caution. If you have any intestinal issues, any artery or vein issues in your abdominal region, definitely discuss this with your doctor first, because it may not be appropriate and could cause serious damage there. But I think if you can get used to this and use this in the correct manner, I do think this will help relieve a lot of the psoas tightness and a lot of the lower back pain. If you have any questions, reach out to me at 703-912-7822 or schedule online at novacarwellness.com.